First of all, we have insurance companies that are acting like states. They are controlling the people by enforcing laws that, if you want to take the conservative sense, abridges the privileges, because conservatives now have said that healthcare is more of a privilege. But right off the bat, we know that what they're doing by hiking insurance rates, by discriminating against people with pre-existing conditions and people with multiple conditions, that it is actually abridging those very privileges to a good healthcare system. We need one that works, and Republicans have been talking about it since the days of Theodore Roosevelt, when he was last president in his second term, and then as a Bull Moose Party member, as part of the Progressive Party. And instinctively, what these healthcare insurance providers are doing right now, which they're good people, but what they're doing doesn't reflect the overall goodness of their hearts, is they're depriving the people of life. It says right here, nor shall any state deprive any person of life. And by denying people pre-existing conditions, you are telling them that you're not worthy of a doctor's checkup, which could then reveal that you have cancer in your ovaries, or cancer in your breasts or brain, or different maladies and different neurological based diseases like Parkinson's or Alzheimer's, and you won't be treated for that, and because of that you will be laid off of your health insurance plan, and you won't be able to get the doctors, you won't be able to get the treatments, you won't be able to basically live as normally as other Americans and people in the federal government can with their exchange system. And liberty is another word here. I think what's really striking is the fact that, yes, the liberties of these people are being denied by the very insurance companies, because they hike these rates without even consulting them, without even asking them if it's okay, so they can't even choose whether or not they want these rates to be hiked up. And if that's the case, most Americans would say that they don't want those rates to be hiked. It's an injustice to our system. It's an injustice to them and their property. Well, what happens when healthcare becomes an economic issue? It becomes an economic issue when you lose your house because you can't pay your bills, and your healthcare bills, because the premiums are going up, and you can't get the coverage. And so if you can't get the coverage, you're less likely to stay in your house. You're likely to move out somewhere that you can afford to live, or you'll just have the government foreclose upon your home, or banks foreclose upon your home, because it is a mortgage issue at that level. And so your property is definitely at stake here too, if you want to be more materialistic about it, which the American people are generally not materialistic about it. And it also says, nor deny any person within its jurisdiction equal protection of the law. We have to make sure that that healthcare reform in its present form, when it's passed, actually provides that equal protection of the law. It's a basic right, in my opinion. And I'm a Republican. And I believe that it is a right, that we have a life, that we have a liberty, and we have the pursuit of happiness, and the rights to each of them, respectively. And I think that anything that goes into destroying those basic rights ought to be deemed as unconstitutional and should be fixed. And I applaud the President of the United States, Mr. Barack Obama, for putting the emphasis back on the people, because when we have this corporate malfeasance at the highest levels, and we have insurance rates that go up 25 to 39% in the case of Anthem Blue Cross in California, it just goes to show that there is nothing that they will go to stop them doing this, and that they will, because they foresee the reforms taking place, which will take that bargaining power that they have collectively, and then have that bargaining power expanded under the exchange system, which I favor because it doesn't expand the control of government over anybody's lives or over corporations or over the healthcare sector. It does benefit them to, in the short term, increase those rates because they know that over time, while they'll still be making profits, they'll just be making less of it. If it is about the Constitution, if it is about life, if it is about liberty, if it is about the pursuit of happiness and the due process clause, well, I tell you this much, we need reform and we cannot wait, because the longer we wait, the longer Congress dithers, the more that we have partisan divides and we have people who say that this can't happen. What's happening to the American people who don't have insurance? They're likely going to be dropped coverage. They'll be laid off in that economic sense because it is a 17.5% economic issue in our economic structure, and that is a system that I just won't tolerate, and nor should the American people. So I commend the President for his leadership. It is about time Congress shows its spine, and that we have members of both political parties make phone calls, and independents as well, make phone calls to the elected representatives to make sure that this happens. Because change is, of course, very hard. But what is so easy and so readily apparent is that the present system is unconstitutional. We need a constitutional system, and that we must need it urgently. And I cannot stress to you how important this is, because this is a life or death issue. We don't want another 44,000 Americans to die. That's maybe that could be a stretch or misquoting, but but the Harvard study just said that some 44,000 Americans are dying because of this, maybe 440,000. And of course, Representative Grayson on the floor, Alan Grayson, a Democrat of Florida, gave that infamous floor speech in the House, and he quoted that very study. So I think it's best that we use what he said there, because they don't have health insurance. And we cannot let that system persist even further. That must be stopped, and we must refresh our healthcare history, and we must start enacting these reforms, and we must have those reforms put in place so that we can act on a more constitutional basis and a more constitutional framework for the American people. Thank you very much for listening. God bless all of you, and God bless the United States of America. Thank you.